So in 2023, what are your expected returns from an IV iron infusion in the treatment of restless leg syndrome? I'm Dr. Andy Burkowski of ReLACS Health, and today I want to talk about what is expected after one gets an iron infusion for treatment. Now, as I've talked about elsewhere, when you do oral supplementation of iron, particularly if you're taking the supplement with meals or multiple times per day, you're really getting 10 cents on the dollar when it comes to absorption of iron into the body. Now, if you're taking iron every night or every other night on an empty stomach, you might be getting this much iron into your system. With an IV iron infusion, because it doesn't involve absorption of iron from your gastrointestinal system, you might be getting this much return on your iron investment. And by the way, this was pretty expensive to be used as a prop. I think I paid close to $50 for it. Well, anyway, once you get that high dose IV iron infusion, what is expected to happen? Well, it's like getting a cash infusion, really. You're first going to have to pay off your creditors, particularly like that big credit card debt you have hanging over your head. The money's going to go there first, but the money's going to go elsewhere. It's going to go primarily to paying off your mortgage. So your mortgage in some ways is like your bone marrow. Your bone marrow is going to take up that iron and use it to make red blood cells. Iron is the building block for hemoglobin, and your body will prioritize making red blood cells because that's what carries oxygen. That's what helps to sustain our lives. But after several weeks after the iron infusion, the iron's starting to get used up. You're paying off all sorts of debts. And finally, you have iron to get into your brain. And roughly about 6 to 8 weeks out is when we would expect the peak of symptom improvement to occur. That doesn't mean you won't get improvement to your symptoms the first night after your iron infusion, but it'll gradually improve up to the point of 6 to 8 weeks. Now, of course, some people have no response whatsoever to iron. Some people get a partial response. And then people with augmentation, they do have less severe withdrawal when they come off of dopamine agonists when their iron levels are higher. So the benefits can be different from each individual. But really, at about 6 to 8 weeks is when you want to recheck those iron levels in the blood to make sure you're at the goal for where you want your iron levels to be. And one other important point is if you are taking iron supplements, to stop taking them immediately after the infusion, as once your iron levels become very high after the infusion, your body will not want to absorb any iron through the gastrointestinal system. If the iron levels are still low after 6 to 8 weeks, it's recommended that you repeat the infusion. And I've talked about infusion and what iron levels to target elsewhere, but in general, for the average person, the ferritin level should be above 100, and the morning fasting transferrin saturation or iron saturation should be at least 20%. But remember, there's no correlation exactly between the blood levels of iron that you're testing and what's actually getting into the brain. So some people need much higher blood levels of iron than even those numbers I've just given you. As always, this video is for general informational purposes only. It does not constitute the practice of medicine. All medical decisions should be made with the assistance of a licensed medical provider. And as I and the dog sometimes likes to say, one of the keys to sleeping well as she is to relax.